Are you over 60 and feeling tingling, numbness, or weakness in your hands and feet? Don't ignore it. In the next few minutes, I'll give an easy solution that helps support your nerves and improves daily comfort. Watch till the end to protect your health. Then like this video, subscribe to the channel, and comment where you're watching from. Close your eyes for a moment and imagine this. You wake up in the morning, your feet feel like they are on fire, your fingers feel numb, and a strange tingling travels up your legs. You shake your hands, you rub your feet, and you quietly tell yourself, this is just age. But what if that thought is the biggest mistake many people make after 60? What if your body has been asking for help for a long time, and no one explained it to you clearly? After the age of 60, nerve discomfort becomes one of the most ignored health problems. Seniors often talk about joint pain or blood pressure, but nerve pain stays hidden. Burning, pins and needles, electric shocks, weakness, or loss of feeling are brushed aside as normal aging. The truth is, aging does change the body, but constant nerve discomfort is a signal, not a life sentence. Your nerves are living tissue. They react to care, stress, and nutrition just like the rest of your body. Nerves work like electrical wires. They carry messages from your brain to your hands, feet, muscles, and organs. When these messages slow down or get disturbed, the body starts feeling uncomfortable in quiet ways first. Maybe balance feels off. Maybe sleep becomes difficult. Maybe holding small objects feels harder than before. These changes often build slowly, which is why many seniors don't connect them to nerve health until daily life becomes harder. One major reason nerve problems appear more after 60 is that the body's internal support system weakens. Nutrient absorption drops. Digestion is not as strong as before. Some medicines reduce how well certain nutrients are used. Over time, nerves lose the support they need to stay protected and active. When that support goes down, nerves become more sensitive and less efficient at sending signals. Here is something very important to understand clearly. This video is not about cures, miracles, or overnight changes. Nerve health takes time, patience, and the right support. There are no guarantees and no shortcuts. Medical care always comes first. However, research does show that certain nutrients can support nerve structure, help maintain normal nerve signaling, and promote healthier communication between the brain and body. This is about support and prevention, not replacement for professional care. In this video, we will talk about 2 nutritional supports that are often discussed in relation to nerve health in older adults. These are not internet myths. They are backed by scientific understanding and are widely known in the health community for their supportive role. When used responsibly and with guidance, they may help the body maintain nerve comfort and function as we age. If you are over 60 and want to protect your independence, movement, and daily comfort, stay with me. What you are about to learn may change how you think about nerve health from today onward. Number 1. Vitamin B12, nerve support nutrient. Now let's talk about the first and most important support for nerve health after 60. Vitamin B12. This vitamin is not popular because of hype. It is important because your nerves depend on it every single day to function properly. Without enough B12, nerves slowly lose their protection, and that is when problems begin quietly. To understand why vitamin B12 matters, you need to know one simple thing. Every nerve in your body is wrapped in a protective outer layer called the myelin sheath. Think of it like insulation around an electric wire. When that insulation is strong, signals move smoothly from the brain to your hands, feet, and muscles. When it becomes weak or damaged, signals slow down or misfire. That is when people feel tingling, numbness, burning, or weakness. Vitamin B12 plays a key role in maintaining and supporting this protective covering. It helps the body keep nerve signals clear and organized. When B12 levels are healthy, nerves are better able to communicate with the brain. This does not mean pain disappears overnight. It means the environment around the nerves becomes more stable and supportive. After 60, many seniors quietly become low in vitamin B12 without realizing it. This is not always because of diet. As we age, the stomach produces less acid, which makes it harder to absorb B12 from food. Certain common medications can also reduce absorption over time. The result is a slow drop in B12 levels that often goes unnoticed for years. When B12 support is low, nerves may become more sensitive. People may notice cold feet, burning sensations at night, numb fingers, or trouble with balance. These changes often happen gradually, which is why they are blamed on aging instead of nutrition. But in reality, the body may simply be lacking proper support. Another important role of vitamin B12 is supporting energy production inside nerve cells. Nerves need a lot of energy to send messages all day long. When energy production drops, nerves fatigue faster and signals become weaker. Supporting B12 levels helps nerves stay active and responsive, especially in the long nerves that travel to the feet and hands. It's also important to understand what vitamin B12 does not do. It is not a miracle fix. It does not replace medical treatment. It does not reverse severe damage on its own. What it does is help create better conditions for nerves to function and stay protected. For many seniors, this support can make daily life feel more manageable over time. The key takeaway here is simple. Nerves need protection, energy, and stability. Vitamin B12 helps support all three. That is why it is often discussed first when talking about nerve health after 60. In the next part, we will look at a newer, natural support that focuses on the connection between the brain and nerves, and why researchers find it so interesting. Number 2. Lion's mane mushroom, brain, nerve support. Now let's move to the second support, and this one surprises many seniors because it does not work like a typical vitamin. Lion's mane mushroom extract is talked about not because it masks discomfort, but because of how it supports communication between the brain and the nervous system. This is important because nerves do not work alone. Every nerve signal starts in the brain. Lion's mane is a natural mushroom that has been studied for its role in supporting something called nerve growth factor, often shortened as NGF. You don't need to remember the scientific term. What matters is what it does. Nerve growth factor helps support the maintenance, survival, and normal function of nerve cells. Think of it as a support signal that tells nerves how to stay active and connected. As we age, this internal support system becomes weaker. The brain may still send signals, but the nerves receiving them are slower, less responsive, or less organized. That is when people feel delays, confusion in movement, or strange sensations in the hands and feet. Lion's mane is studied because it helps support the environment in which nerves communicate, especially between the brain and the rest of the body. One reason seniors find this interesting is because nerve discomfort is not only physical. It often affects focus, confidence, and balance. When the brain and nerves are not working smoothly together, the body feels unsure. Lion's mane is known for supporting cognitive clarity and nerve communication at the same time, which makes it unique compared to single-purpose nutrients. Another important point is that lion's mane does not act aggressively. It does not force change. Instead, it works by supporting natural processes already present in the body. This is especially important after 60, when gentle, consistent support is often better tolerated than extreme interventions. Research interest around lion's mane focuses on how it may help maintain nerve structure and encourage healthier signaling pathways over time. This does not mean instant results. Nerves change slowly. Any form of nerve support works gradually, just like nerve stress builds gradually. Seniors who think long-term usually understand this best. What also makes lion's mane appealing is its role in the brain-nerve connection. Many people focus only on where they feel discomfort, such as feet or hands. But the command center is always the brain. Supporting brain health can indirectly help how nerves respond, react, and adapt to daily demands. It is important to say this clearly and honestly. Lion's mane is not a replacement for medical care. It does not promise reversal of serious nerve conditions. What it offers is support for nerve communication, support for brain signaling, and support for maintaining function as the body ages. When vitamin B12 and lion's mane are discussed together, it is because they support nerve health from two different directions. One supports the nerve structure and energy. The other supports communication and growth signals. In the final part, we will bring this together and talk about how seniors can think about benefits realistically, stay safe, and protect their quality of life moving forward. Now that we've explored vitamin B12 and lion's mane mushroom, Let's bring it all together and see what this means for seniors who want to support their nerve health. Both of these nutrients work in different ways, but together they create a stronger foundation for nerves. Vitamin B12 helps maintain the protective sheath around nerves and supports energy inside nerve cells. Lion's mane helps the brain and nerves communicate better, supporting natural nerve growth signals and smoother messaging throughout the body. It's important to understand that these nutrients are supportive, not curative. They don't replace medical care, treatments, or therapies prescribed by your doctor. Instead, they help your body maintain healthy nerves, improve daily comfort, and support overall function in a gentle, natural way. Many seniors notice that when B12 and lion's mane are included in a balanced routine, sensations like tingling or numbness feel less bothersome, and focus or coordination may feel steadier. Everyone's body reacts differently. Age, overall health, medications, and nutrition all play a role in how much benefit someone experiences. That's why it's crucial to consult a healthcare professional before starting any new supplement. A professional can test B12 levels, discuss appropriate dosages, and help determine if lion's mane fits your routine safely. Taking guidance ensures you receive the right support without risks. In short, these nutrients offer a scientifically supported way to nurture your nerves and maintain daily function. They help create an environment where nerves are better protected and connected, promoting a safer, more confident lifestyle. Remember, supporting nerve health is a long-term process, and consistent, gentle care works best. This video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your physician or qualified healthcare provider with any questions about nerve health or supplementation. If you found this video helpful, like this video, subscribe to the channel for more senior health tips, and comment below telling us where you're watching from and which tip you found most useful. Your feedback helps us create more content that supports your health and well-being.